Dress code is important in both clinical and surgical field. It is necessary in order to present a smart and professional image, thereby increasing patient and public confidence, support infection prevention and control, and have regard to health and safety considerations for the staff. In certain areas, scrubs, or also known as theatre blue, may be appropriate to the clinical work undertaken. The scrubs must be cleaned at the beginning of each shift and changed each time they become stained with blood and bodily fluids. It is restricted to the designated areas and should not be worn outside or when leaving these areas. I will now be covering roughly on the theatre etiquette, specifically on how to dress in the operation theatre. The aim of theatre etiquette is to reduce the risk of infection. To achieve this, everything in the operation theatre must be sterile, cleaned after every use, and be as clean as possible as we can get them to be. Scrub should cover any other clothing, such as underwear, and trousers legs should not touch the floor as these may transport bacteria from one place to another. The person who is assigned to scrub should also adjust the sleeves of their scrub to at least 4 inches above the elbows. This is to prevent them from getting wet and potentially increasing the risk of contamination of the gown. Surgical attire fabric should be free on lint, provide comfort and allow for breathability while containing the shedding of skin squames. The fabric should be tightly woven to prevent skin squames from being released through the pores of the fabric into the environment. Studies have shown that scrub suits made of 100% cotton fabric should not be worn for the following reasons. Firstly, cotton fabrics typically have large pores and are not tightly woven to allow the dispersal of skin squames into the environment. Next, cotton fabrics have a high level of shedding length. Cotton fabrics are also highly flammable, and therefore 100% cotton doesn't meet the federal standard for flammability. It is recommended scrub suits that are made of 100% spun-bound polypropylene in order to contribute to decrease of the environment by the shedding of the skin squames. Well, now let us move to the other one of the important attire for the operation theatre, which is the disposable surgical caps. The surgical cap must cover all hair, and disposable hoods must be worn by staff with facial hair. The surgical head cover is important to prevent shedding of hair, squamous cells, or dandruff onto the scrub suit, which will compromise the infection control during the surgical procedure. For reusable cloth head cover, it needs to be immediately removed and laundered once it becomes contaminated with blood or body fluids. For disposable head cover, it should be removed and discarded as soon as possible once it is contaminated with blood or body fluids. Surgical face masks are plain masks that cover the nose and mouth and are held in place by fabric ties or with elastic strap around the ear. So what are the reasons for wearing surgical face masks in the operation theatre? And do they actually serve any purpose? Well, the surgical face masks mainly serve to prevent bacteria entering the patient. The aerobic bacteria, such as Streptococcus species, which are the normal flora of the human nasal cavity, can pass into the bloodstream of the patient as a result of the surgeon sneezing or even breathing. Besides that, the surgical face mask also helps to capture respiratory secretions in exhaled breath rather than to protect the operators from airborne infections. wear a surgical mask with tie band. First, preform the nose clip. Place the surgical mask on your face, making sure to cover your nose and mouth. Next, position the upper tie bands at the crown of your head and tighten securely to minimize air leakage. Position the lower tie bands at the nape of your neck and tighten. Always unfold the mask fully to minimize the number of layers you have to breathe through. Change surgical mask when contaminated as well as between operations. When there is a risk of fluid splashes, use a splash-resistant surgical mask and protective eyewear or a splash-resistant surgical mask with a visor. Dispose of the surgical mask after each use. To don a surgical mask with the ear loop, first put your fingers through the ear loops. The nose clip should be positioned at the top. Place the mask over your nose and mouth. Next, position the ear loops around the ears. Pull the mask from the top and bottom to fully unfold the pleats of the surgical mask. This will provide maximum coverage of the face and minimize the layers you have to breathe through. Form the nose clip over the bridge of the nose to minimize air leakage. Ears and hair should be covered with an appropriate choice of headwear to minimize spread of hair and other particles. If there is a risk of fluid splashes, ensure that you select either a 4-layer splash-resistant surgical mask. Change face mask when contaminated as well as between operations. Dispose the surgical mask after use. Shoes should only be worn in operating room only and not on the outside of the environment. This is because it could spread microorganisms and debris to outside areas and would also introduce microorganisms and debris from the outside to the operation theatre. Shoes should have a closed toe and a closed back, have a low heel, and the sole should be made of non-skid material to prevent slipping or tripping. The top surface of the shoe should not have any perforations to prevent any blood and body fluids, liquids, or sharp objects from penetrating the perioperative personnel skin. For the shoe covers, it comes in different lengths, beginning with covers that only cover the shoe, made up of impervious material to prevent fluid penetration and absorption. Shoe covers is recommended when the surgical procedure may result in extensive fluid release. Jewelry such as rings, bracelets, and watch should not be worn during scrubbing. Jewelry is not sterile and can harbor microorganisms. Studies have reported a significant increase in bioload on the hands of personnel who wear rings after performing a hand wash as compared to personnel who perform a hand wash and are not wearing any rings. Studies by Hoffman have also demonstrated that the skin underneath rings is more heavily colonized as compared to areas of the skin where rings were not worn. Jewelry is removed in order to allow the surgical scrub solution to make contact with the entire skin of fingers, hands, and forearms. Besides that, fingernails must be clean and short. Short nails are less likely to puncture gloves and therefore reduce the risk of harming patient through transfer.
Dress code on leaving theatre areas. First, reduced levels of contamination were found on theatre suites when cover gowns were worn outside the OT. Whenever leaving the healthcare facility, the surgical personnel should change into street clothes. Scrub suits worn outside the facility can come into contact with external microbes and contaminants and be transported into the facility environment. A used scrub suit should not be stored in a locker or hung in the changing room to be worn again. Scrub suit that has been contaminated should be changed as soon as possible. And lastly, disposable shoe covers and masks should be removed prior to leaving the surgical or procedural area.
Operation theatre staff who have to leave the theatres when there is an emergency should change their theatre suit on return. If the case is known to be colonized with multiple resistant bacteria and is not at the end of the operating list, theatre dress should be completely changed by all members of the operating team and anesthetists, and hence shall be properly cleansed before proceeding to the next operation. Well, I guess that's all from our group. With that, thank you.